Some time ago, I noticed a little boy of about 3 months or thereabout, not exactly leaving his milestone age, and I had to call his mom's attention to it. She was a bit confused at first, and later she took to my advice to take the boy to go see a pediatric developmental doctor. And true to my observations, the boy had a hole in his heart, and he was diagnosed of having Down syndrome. Hello, listeners. You're welcome again to another edition of Advocating for Specially Abled Children. My name is Oluwaseyi Obasa, and I am your host on this radio program put together by Amorgate Radio Communications. Today we'll be looking at Down syndrome. In every cell in the human body, there is a nucleus where genetic materials are stored in genes. Genes carry the code responsible for all of our inherited traits and are grouped along what looks like a rod-like structure called the chromosomes. Typically, the nucleus of each cell contain about 23 pairs of chromosome, half of which are inherited by each of the parents. So Down syndrome occurs when an individual has a full or partial extra copy of chromosome 21 in their cells. So what are the causes, or what is the cause of Down syndrome? Now, Down syndrome is usually caused by an error in the cell division called non-disjunction. This is not, there is no known cause, or nobody knows why this occurs, But however, it is known that this error occurs at conception, and it is not related to anything the mother did or what she did not do during pregnancy. It is just, it has just been known for some time that the incidence of Down syndrome increases with advancing maternal age. However, 80% of children with Down syndrome are born to women under 35 years of age. The addition of the partial or full copy of the 21st chromosome, which is the cause of Down syndrome, can be from either the mother or the father of the child. How then can we identify children that have Down syndrome? Down syndrome causes physical, cognitive, and behavioral symptoms. Not all people with Down syndrome have all of these symptoms. Symptoms and their severity are different from person to person. Okay, so please let's take note. The first we need to look at are the physical signs of people, either children or adults living with Down syndrome. Physical signs of Down syndrome are usually present at birth and become more apparent as the baby grows. And these include a flat nose bridge, slanted eyes with point upwards, a short neck, small ears, hand and feet, weak muscle tone at birth, a small pinky finger that points inward towards the thumb, one crease of the palm of their hand. We call that palmar crease. Shorter than average height. So as the child grows, additional symptoms can arise because of the way that their body develops in the uterus, and these include ear infection, hearing loss, vision problem or eye disease, dental problems, being more prone to infections or illnesses, obstructive sleep apnea, congenital heart disease, like was diagnosed in the child that I observed, and then your child's healthcare provider will regularly check for these and other conditions that may cause additional symptoms throughout the child's life. Now, there are further symptoms that can also be checked up on. We have the cognitive and the behavioral symptoms. So let's quickly take a look at the cognitive symptoms of Down syndrome. Okay, a child living with Down syndrome may have some of these cognitive development challenges as a result of their extra chromosomes, like I earlier said, and these can cause intellectual or developmental disabilities. The child's ability to meet developmental milestones or things that the child can do at a certain age may differ from other children, and some of them include walk and move, that's gross and fine motor skills, language development skills, that's speaking, cognitive skills, that's learning, social and emotional skills, play. That child will not be able to foster or initiate play. As a result of these, it may take that child longer to do the following: toilet training, speaking their first words, taking their first step, eating food independently. So please, it's important for parents to take note of these things, and as soon as they are observed, they should please take the child to see a pediatric developmental doctor. Also, we have some behavioral symptoms of Down syndrome, and some of these are the child exhibiting stubbornness or tantrums, difficulty paying attention, obsessive and compulsive behaviors. So sometimes you see that these children are strong-willed, and then because they are probably not able to express themselves, they throw tantrums. They are not able to pay attention, and they are obsessive about a particular thing. It could be an object, it could be a color, a particular pattern, they have this compulsive behavior. Now, how is Down syndrome diagnosed? Down syndrome is usually identified at birth or shortly after birth. Initially, the diagnosis is based on physical characteristics that are commonly seen in babies with Down syndrome, which include low muscle tone, a single crease across the palm of the hand, slightly flattened face profile, and an upward slant to the eyes. The diagnosis must be confirmed by a chromosome study. The chromosome study is called karyotype. That's the kind of test that could be run for the child. It's a test that is carried out to check the chromosome. Okay, so that will provide a visual display of the chromosomes grouped in their size number, and shape. This chromosome study may be performed by examining blood or tissue cells, and this is not related to race, nationality, religion, or socioeconomic status of the individual. Now, this information will be very, very useful for expectant parents. So, as soon as a woman finds out that she is pregnant, please do a screening test. Do a screening test. There are two procedures that are available: the screening test and the diagnostic test. The screening test estimates the risk of the baby having Down syndrome, while the diagnostic test tells whether or not the baby actually has Down syndrome. Please, it's important. I have had situations where, now please, let's not live in ignorance or in denial. It's very important. I've had situations where mothers go for tests and they find out, pregnant women go for tests and they find out that the child has a high probability of having Down syndrome, and they are advised to evacuate the fetus. Now, please, let's not attach emotional sentiment to it. Please, let's take doctor's prescription at any given point. Now, these measures are actually to help reduce the risk of having people to have more children with Down syndrome. Now, learning and development in individual with Down syndrome is also very important. So while children and adults with Down syndrome experience developmental delay, they also have many talents and gifts and are given the opportunity and encouragement. Most children with Down syndrome have mild to moderate impairment, but it is important to note that they are more like other children than they are different. Okay, so let's not downplay the talent and gifts that these children can have. I also like to always advocate for early intervention. I always like to advocate. So let's, mothers, fathers, guardians, let's quit feigning ignorance, calling it spiritual issues, because early intervention can help your child lead almost a normal life. I personally advocate for early intervention because your child will need physical therapy, they will need speech therapy, they will need self-help skill therapy, they will even need behavioral therapy. So please, let's not downplay the fact that early intervention helps. It is not highly uncommon for high school graduates with Down syndrome to participate in secondary school exams. A lot of them do, and they do very well in their studies. So we have had people living with Down syndrome do exceptionally well. They have they have impacted their generations. They have really, really impacted their generation. So in as much as there are restrictions to what they can do, like driving, like operating machines, they can also still learn some vocations like cooking, baking, do carpentry work, and they can succeed well in them. We have some of them even as writers, so they can succeed well. Let's not feign ignorance and ostracize these children. Down syndrome is not a disease. It is just a chromosome impairment. It's just a chromosome impairment. So let's not ostracize these children. And once again, I want to thank you, my listeners. It's been an awesome time with you. Till I come again in the next episode. Have a wonderful week. Thank you.